Welcome to the 88th General Session of the World Assembly of Delegates of the World Organization for Animal Health. For the first time, we are gathered virtually for a general session. Our objectives remain strengthened, exchanging information and ideas on the global animal health situation, assessing future evolutions, building solutions, and adopting new international standards to improve animal health and welfare for the sake of everyone. After months turned upside down by the COVID-19 crisis, challenges are huge. While the pandemic has brought the world to a standstill in certain ways, veterinary professionals have continued to respond globally to the emergency management of COVID-19 and today's challenges. The origins of the sanitary situation stresses the necessity of the work done by the World Organization for Animal Health and its members worldwide to prevent animal diseases and their impact on global health and economic activities. Today, more than ever, the World Organization for Animal Health's role and activities are crucial. Collecting, analyzing, and disseminating scientific information, supporting veterinary services everywhere, with solidarity as a cornerstone, preserving terrestrial and aquatic ecosystems, ensuring food safety and animal welfare as the keys for a sustainable future.
Mr. President, Madam Secretary General, distinguished delegates, specially invited guests, good morning. It is my distinct honor to have been invited by you, Madam Secretary General, to address this august body today. 97 years ago, this past January, your organization was founded with the purpose of fighting animal diseases and improving animal health worldwide. The One Health approach is especially needed in the global effort to combat the slow-moving pandemic that is antimicrobial resistance, or AMR as most of us call it. The overuse and the abuse of antimicrobials in humans, in animals, and in agriculture has driven up resistance in the microorganisms that these medicines are meant to fight. The lack of effective regulation, the excessive use of antibiotics as growth promoters in animals, and the rise in counterfeit antimicrobials further exacerbate this situation. My friends, AMR threatens to make redundant the medicines that we rely on to keep our animals and our plants healthy. This threat is not an academic one, but a real threat, as our public health and veterinary laboratories are regularly detecting antibiotic-resistant strains of common bacterial pathogens. We're already running out of effective treatments for several common infectious drug-resistant diseases, with few, I may add, replacements in the pipeline. In short, we run the risk of reversing a century of medical progress, a century of progress equally in our treatment of animals. Responsible, sustainable access to and use of antimicrobials, the promotion of vaccines where possible, implementing biosecurity measures on farms and the use of sanitary and responsible farming practices. All of these are effective measures that must be employed to mitigate against drug-resistant infections. The challenges, yes, are complex and multifaceted, but they are not insurmountable if we act in solidarity and if we commit to doing so from today. We can begin by integrating the response to AMR in future pandemic response plans and into preparedness plans, by encouraging changes in individual behavior as it relates to the use and overuse of antibiotics, and by avoiding foods and other animal products that are as a result of improper husbandry practices. Member countries must also follow the OIE guidelines on the prudent use of antimicrobials. What is needed more than ever, my friends, is simple, effective communication, and of course, absolute political leadership. We all know that that is what will make the difference. And when we can reduce the questions to simple ones, where will you be in 2050 when the world is likely to be threatened by the greatest of all of the pandemics, the slow motion pandemic of AMR? Mr. President, in closing, I'd like to ask you, your council, and the delegates gathered here today to commit to working in partnership with the Global Leaders Group on antimicrobial resistance. I have the honor to co-chair this group with my colleague, Prime Minister of Bangladesh, Her Excellency Sheikh Hasina Wazed. We need everyone from all of the agencies that are involved in this, OIE, FAO, and the WHO, focusing on ways to stop AMR in its tracks and to find long-term solutions to this problem if life as we know it is to survive. We thank God that the United Nations Environmental Programme has joined those three associations, ensuring that any negative consequences to our environment can also be addressed as we fight this major battle. I don't know how many of us will be around, but we need to start to sensitize each and every one, because it is only when persons individually or collectively in groups or companies or entities or non-governmental organizations or religious groupings take the steps to be able to confront the problems of our generation that we can ensure that we do our best to protect our animals, to protect our environment, and of course, to protect ourselves as human beings. I wish you all the very best in your deliberations. I'm obliged to you. Thank you.
Program Director, Honorable Ministers invited to this 88th General Session of the OIE, Dr. Mashkip, President of the OIE International Committee, Dr. Monique Eloit, Director General of the OIE, representatives of all international organizations, country delegates of the OIE, invited guests, ladies and gentlemen. It is an honor for me and my country to have been invited to open the 88th General Session of the OIE. I convey to you the warmest greetings from the government and the people of the Republic of South Africa. One Health is a collaborative, multi-sectoral, and transdisciplinary approach in an understanding that the health and well-being of people is closely connected to the health of animals and our shared environment. The global population has been growing. We now have better understanding of human and animal diseases. We've also developed new technologies to handle conditions that were decimating lives in the past. We, however, have new challenges that are as a result of diseases that move or mutate between human beings and animals. In this context, building sustainable One Health approaches, incorporating the animal health, including wildlife, human health, and environment into the national health system is one of the necessary considerations that our generation needs to make. The COVID-19 pandemic is a singular disruptive event in recent human history, and more importantly, veterinary services was diagnosed as an essential services that must function to ensure animal health and food security, amongst many other essential services continue to operate. Available laboratory capacity from veterinary perspective was made available to the Department of Health for faster handling of samples. As a result, the collaborative approach has helped to manage the situation. Ladies and gentlemen, whereas it is my understanding that this respectable gathering will be adopting standards for the control of animal diseases, animal welfare, and trade on animal and animal products, I also appreciate that we would be looking at the standards to provide and benchmark against which each member will be able to evaluate their performance. It is my advice that those standards must be implementable by all the 182 members of the OIE, developing and developed in such a way that they prevent the spread of especially fast diseases that has an impact of threatening the future of humanity as well as the future of animals and the environment. The implementation of adopted standards should not disturb the noble vision of ensuring that there is food security needs for all our citizens globally. I therefore wish all of you the best as you consider and deliberate in this general session. Thank you.
Sua Excelência Senhora Presidente da OIE, Doutora Monique Eloide, excelentíssimos senhores ministros, excelentíssimos delegados, digníssimos convidados, minhas senhoras e meus senhores. É para mim uma grande honra, enquanto Secretário de Estado para a Agricultura e Pecuária, participar pela primeira vez na 88ª Secção Geral da Assembleia Mundial dos Delegados Nacionais da OIE, em representação do Ministro da Agricultura e Pescas de Angola. Fomos chamados para, de forma responsável, abordarmos as questões que nos foram colocadas pela organização aqui nesta magna Assembleia. Assim sendo, relativamente ao termo "um mundo, uma saúde", entendemos nós tratar-se de um conceito abrangente, multissectorial, que envolve as componentes saúde animal, saúde humana, saúde ambiental, com o objetivo de preservar o bem-estar universal e a vida no planeta. Os serviços de veterinária de Angola enfrentam desafios de vária ordem para o efetivo controle da sanidade animal. Como resposta rápida à pandemia da Covid-19, Angola tem trabalhado de acordo com o conceito "uma só saúde", envolvendo diferentes intervenientes no controle do movimento animal e humano nos pontos de entrada, saída e nas vias públicas, quarentenas, investigação, notificação de casos, testagem e vacinação em humanos, medidas de biossegurança, informação, educação e comunicação a todos os níveis e decretos presidenciais. A raiva é a zoonose de maior impacto na saúde animal e humana em Angola. Em conformidade com a abordagem de uma só saúde, desde 2020, os serviços de veterinária estão a implementar um projeto piloto de controlo e eliminação da raiva na região sul de Angola e norte da República da Namíbia, com o suporte técnico, material e financeiro da OIE e da Aliança Global para o Controlo da Raiva dos governos da Alemanha e da Namíbia. Para concluir, gostaríamos de destacar que, para alcançar o objetivo da Estratégia Global de Eliminação da Raiva em Humanos, transmitida pelo cão até 2030, Angola pretende manter o compromisso e dar continuidade ao projeto piloto na região sul e estender para as demais regiões do país. Muito obrigado.
Excellencies, distinguished guests, ladies and gentlemen, it's a pleasure to join you today. I extend my sincere appreciation to the World Organization for Animal Health for organizing this important event to explore the One Health theme and provide a roadmap to achieving this crucial objective. What does One Health mean to the United Arab Emirates? It means biosecurity. To enhance biosecurity across the board, we developed and implemented legislation, strategies, and initiatives in the field of animal, plant, and public health in compliance with the guidelines of the international organizations. In 2013, we issued the National Biosecurity Strategies that comprises 4 pillars: human health and safety, animal health and safety, plant health and safety, and environmental health. Subsequently, in 2019, we launched the online biosecurity early notification system for reporting biosecurity risks, including animal diseases, plant pests, outbreaks, and food safety violations. In the same year, we rolled out the National Strategy and Action Plan for combating antimicrobial resistance. We have also made great strides in building the capacities of our vet laboratories for the detection of animal diseases. I take this opportunity to reaffirm the United Arab Emirates' support to the efforts of the World Organization for Animal Health to safeguard animal health and enhance public health and food safety worldwide. Thank you very much.
Bapak Ibu sekalian yang sama saya hormati, peserta sidang umum yang saya muliakan. Meningkatkan kesehatan hewan adalah juga meningkatkan kesehatan manusia. Meningkatkan kesehatan hewan dan manusia sekaligus itu berarti kita menjaga dunia. Dan hal ini bagi kita di Indonesia, One Health menjadi bagian-bagian dari seluruh gerakan-gerakan mengendalikan peternakan dan tentu secara khusus masalah kesehatan hewan yang ada. Lebih khusus adalah kesehatan hewan yang menular pada manusia atau zoonosis. Kita berharap ini betul-betul kita jaga sehingga apapun sekecil apapun kejadian yang berkait dengan kesehatan hewan mampu terantisipasi dengan baik. Pengalaman kami menangani One Health dapat dikatakan cukup maksimal di Indonesia. Ini tentu karena kita mampu berbagi informasi, berbagi pengalaman secara mendunia. Dan tidak hanya itu, kami merasa dukungan lembaga-lembaga dunia, hubungan antara sesama pemerintah yang menangani pertanian itu cukup berjalan dengan baik. One Health mampu kita kristalisasikan, saya ingin katakan ini makna dari kolaborasi, adanya kebersamaan dunia untuk menghadirkan kehidupan manusia yang makin sehat dari hewan dan ternak yang mampu terkendali. Artinya kesehatan hewan yang terjaga akan dikonsumsi manusia dan lingkungan hidup yang ada mampu kita jaga secara bersama, baik secara nasional maupun secara mendunia. Pengalaman Indonesia implementasi One Health sebelumnya memudahkan sektor kesehatan hewan, khususnya pertanian, untuk berkontribusi langsung dalam merespon COVID-19 ini 1 tahun lebih. Ternyata kita bisa menjaga kesehatan hewan yang ada di Indonesia. Tentu dinamika lapangan ada, tetapi respon cepat, saling membantu. Bahkan kita kadang-kadang di Indonesia meminta bantuan negara lain dari pengalamannya untuk menangani itu. Oleh karena itu, laboratorium kesehatan yang ada di bawah naungan Kementerian Pertanian yang jumlahnya cukup banyak, ini dipakai untuk kesehatan hewan sekaligus bagian-bagian untuk menghadirkan kontribusi kita mencegah penularan COVID-19. Kami bahkan secara khusus di Indonesia ikut membantu hadirnya APD, pakaian-pakaian aman bagi mereka yang melaksanakan tugas-tugas kesehatan, baik kesehatan hewan maupun kesehatan manusia. Diagnosa COVID-19 dari apa yang ada tidak luput dari kontribusi hadirnya kesehatan hewan yang baik dan tidak terjadinya penularan dari rabis-rabis yang ada di sekitar kita. Terima kasih, selamat melakukan pertemuan OIE sedunia hari ini, dan tentu saja semoga menjaga One Health dunia kita bisa lakukan secara bersama. Semoga sidang berjalan dengan lancar, ridha kami dari Indonesia untuk kita semua. Sekian, terima kasih, selamat. Assalamualaikum warahmatullahi wabarakatuh.
Nous vivons pour le meilleur et pour le pire dans un monde d'interdépendance. Interdépendance de nos sociétés dans un siècle d'accélération des échanges. Interdépendance plus que jamais de la vie humaine et de la vie animale. Et interdépendance des vivants et de leur environnement dans un contexte d'urgence climatique et d'érosion de la biodiversité. Ces évidences, la pandémie de Covid-19 est venue nous les rappeler, brutalement et sans équivoque possible. Désormais, nous en sommes tous conscients, l'humanité ne saurait vivre en bonne santé sur une planète malade. C'est pourquoi l'approche « une seule santé » est au cœur de l'architecture multilatérale en matière de santé mondiale que nous promouvons. Une approche cohérente, globale et préventive que la France, vous le savez, a depuis longtemps fait le choix de soutenir. La création à Paris de l'OIE en 1924, il y a presque un siècle, quand l'organisation s'appelait encore Office international des épizooties, en est une excellente illustration. Avec l'OMS, la FAO, le PNUE, l'OIE doit être en première ligne de notre combat pour prévenir les pandémies qui pourraient nous frapper demain. D'abord en continuant à agir pour le renforcement des services vétérinaires à travers le monde et l'établissement de normes internationales en matière de santé animale. Ensuite, avec la mise en place du panel d'experts de haut niveau Une seule santé, créé à l'initiative de la France et de l'Allemagne, qui s'est réuni pour la première fois il y a quelques jours. Je tiens d'ailleurs à saluer l'engagement de l'OIE en faveur de la création de ce panel. Comme le fait le GIEC sur les enjeux climatiques, ce groupe d'experts contribuera à synthétiser et à donner plus de visibilité à des informations scientifiques fiables sur les liens entre santé humaine et animale et environnementale. En cela, ce groupe sera un appui précieux à l'action des gouvernements. J'espère enfin que l'OIE s'impliquera dans l'initiative Présode, lancée par le président Macron lors du One Planet Summit de janvier dernier. Cette initiative internationale de recherche opérationnelle est centrée sur la prévention, la surveillance, la détection et la riposte aux risques de pandémies d'origine zoonotique. Elle permet le renforcement des réseaux de recherche en matière de santé humaine, animale et environnementale. Initiée par des organismes de recherche français, le CIRAD, l'IRD et l'INRAE, l'initiative Présode regroupe déjà plus d'1 millier de chercheurs dans 50 pays sur les 5 continents. L'expérience et l'expertise unique de l'Organisation mondiale de la santé animale, Madame la directrice générale, chère Monique Eloi, seront absolument décisives, car nous devons mettre le dialogue scientifique au service de la coopération internationale. Cela nous permettra de construire dans la durée la réponse que nous devons apporter à la crise pandémique, un multilatéralisme agile, fort des meilleures capacités scientifiques et à même de produire des résultats tangibles au service de la santé mondiale. Je vous remercie.
This year's General Session encompasses the animal health contribution to our contemporary One Health challenges, with sessions that will aim at adopting administrative and technical resolutions, as well as the elections of members of governing bodies and specialist commissions. The unique decision process, one country equals one vote, will ensure a transparent and diplomatic election that represents the needs of our members. The World Organization for Animal Health wishes you a fruitful and engaging 88th General Session.